Polycystic ovarian syndrome, or PCOS as it's commonly known, is both a metabolic and hormonal disorder, which is common in women of reproductive age. And when I say reproductive age, that's women anywhere between the ages of 18 to 45. And we know that polycystic ovarian syndrome affects about 5% of women in the general population. And it is, as I mentioned, it's both a metabolic and hormonal disorder, but its genesis is really in the metabolic nature. And there are some women who are genetically predisposed to having their cells resistant to absorption of glucose from their circulation. And because of this genetic resistance to absorption of glucose, their bodies react by increasing their insulin levels. However, because the insulin levels in these women rise, it through a series of other interactions, it causes a fall in something called sex hormone binding globulin, and therefore the androgen levels. Androgens are male type hormones. They're both in men and in women, but in women they're normally in low levels. However, because of this chain of reactions whereby the insulin goes up, the sex hormone binding globulin goes down, androgen levels in the women rise, and this is not a good thing in women, because once the androgen levels start to rise, they affect the functioning of the ovaries, and they cause the ovaries to not ovulate as normal. And because women stop ovulating, they get irregular periods, and sometimes even in quite severe cases, they stop ovulating, they stop having periods altogether, and they have what we call amenorrhea, no periods at all. But that is at the more severe scale. But most times women have irregular periods where they will have maybe, instead of having 12 periods in the year, they'll have maybe 3 or 4 periods the entire year. They have very irregular, unpredictable periods. And it's because they're not ovulating, that's why they have difficulty becoming pregnant. And we classify this as anovulatory infertility, where a woman is not releasing her egg, and that is the reason why she does not become pregnant.